8 symptoms of lung cancer. 1. Forced breathing. Breathing problems aren't usually a sign of something dangerous, although they are very common among people who are developing lung cancer. Shortness of breath when conducting daily tasks or the feeling that you have to work harder to breathe are indicators that you should visit a doctor about. 2. Wheezing in the chest. Chest wheezing is a typical symptom of respiratory illnesses like asthma and colds. They can, however, signal that something weird is happening in the respiratory tract if they occur suddenly and for no obvious reason. 3. Fatigue, one of the symptoms of lung cancer. In cancer patients, weariness, both physical and mental, is prevalent, especially when the disease affects the respiratory system. This is due to the narrowing of the airways caused by tumors or the retention of liquid in the chest tissues, making it difficult for the cells to oxygenate. 4. Persistent cough. Cough is an immunological reaction to the attack of various viruses and bacteria that grow in the respiratory system, according to an article published by the Caritas Medical Center Hospital. It normally fades gone after a week or two, though it can last longer depending on the circumstances. Similarly, the Spanish Association Against Cancer, AECC, claims that smokers are more likely to get it because tobacco toxins are stored in the lungs. When it happens on a regular basis and for a long time, it's more likely to be caused by cancer cells. As a result, in the following circumstances, you must seek medical advice. The cough is too recurrent and uncontrollable. Bleeding occurs when coughing. The cough contains too much phlegm. It is accompanied by hoarseness. 5. Chest pain, one of the symptoms of lung cancer. A sensation of chest pain that is often exacerbated by physical effort, coughing, or laughing is one of the first signs of lung cancer. It can sometimes expand to the shoulders and lower back, and it usually appears out of nowhere. There's also a potential that cancer cells have spread to neighboring bones if the pain is severe and uncontrollable. 6. Pain in the hands and fingers. Pain in the hands and fingers is one of the early indicators of this type of cancer and, as a result, one of the most overlooked. Some people don't think there's a link between these disorders and respiratory system anomalies because they are in different parts of the body. The American Cancer Society, on the other hand, warns that lung cancer can spread to other parts of the body and disrupt the brain system. It can also serve as a warning indication of malignancies in the respiratory ducts, as its presence obstructs circulation and oxygenation. As a result, the doctor should examine the palms of the hands that have thickened and pale skin. 7. Fever. Fever in lung cancer patients usually occurs as a result of a weakened immune system. In general, it is more frequent after the disease has been diagnosed because some medications trigger it. 8. Phlegm with blood. Even if it's just a few small scarlet specks in the phlegm, coughing up blood should never be disregarded. Its presence could be a sign of cancer or other significant respiratory problems. Despite the fact that these symptoms may not necessarily indicate the presence of an oncological disease, it is critical to assess them as soon as possible in order to acquire an accurate diagnosis. Also, remember that leading a healthy lifestyle and avoiding tobacco use are simple methods to lower your risk. Thanks for watching.